I thought medicine was intriguing probably from the time that I was a teenager, although I have to admit I initially was thinking about going into ophthalmology because of optics, and again with physics and so on. But over the course of my training and exposure to various specialties, I became more enamored with cardiology. Well, my first goal is to get to know the patient and to understand what it is that they're concerned with. And the entire focus of the visit will be to ascertain what their expectations are, what their needs are, and try to bring the two of those together. Sometimes patients have expectations that don't necessarily correlate well with their needs, and it's not good enough to be able to say, well, that's nice, but this is what you need. They need to understand why, so that they embrace the entire diagnosis and treatment regimen that we talk about. In our practice, we tend to take the role of primary cardiology, which is to see the patient not just for their acute illness, but to give them lifelong benefit in cardiovascular medicine. We at the line of general cardiology and clinical cardiology cherish the relationship that we have with our subspecialty colleagues so that we can provide the most direct care for the patients. And I tend to be the orchestra conductor for each of those individual instruments. But it's most rewarding to be able to be on the front line, to see the patients when they first present, and to sort out what directions they best need to go in. That sense of having the patient be able to say to you, thank you, this feels so much better, I feel better, is still the most rewarding part of my career.